Greetings. My name is Johnny Love, and today I will be discussing a news article with you all. According to New York Times, as of February 20th, 2020, the article titled as Millions of Americans Have Moved Off of Assistance. Does Trump get credit? Donald Trump correlated his economic policies as a fuel for the decline in Americans receiving aid from multiple government programs. This article then describes the increasing drop in Americans utilizing food stamps from 3.5 million in July 2018 to 5 million that next spring, and in February, 7 million Americans not utilizing food stamps. This overall shows benefits on government's programs such as the Supplemental Nutrition Assistance Program, categorizing whether the president is pushing individuals off of these economically supported programs or was the president strengthening the economy so citizens would not have to depend on food stamps. This is very controversial due to the fact that many disadvantaged individuals that are pushed off of this service will be limited in the resources needed for basic necessities to accomplish the lower level of Maslow's hierarchy. However, on the other hand, if the poverty level is declining in the United States, this could improve us as a whole society and show the abundance of growth that we have endured. So, are we taking steps to help our citizens or are we hindering our citizens? Was the president lifting individuals off of food stamps or kicking them off? Another prominent objective that this article mentions is that the president had progress to tightly control the government safety benefits for the vulnerable populations, such as enabling states to add work requirement for Medicaids with attempting to deny citizenship to legal immigrants who enroll in public assistance. As one can see, vulnerable populations are evidently targeted. The article also emphasized how states are requiring so much out of low-income populations, such as them completing an abundance of paperwork of hard-to-find documents along with meeting human services in person without them even considering that these individuals may have unreliable transportation or unpredictable working hours for individuals trying to meet basic needs for themselves or even their families. Failing to strengthen these populations or even meeting halfway to assist basic needs of the disadvantaged could take a toll on the economy as a whole. It is important for the government to understand the lifestyles of these vulnerable populations or even disadvantaged individuals to thoroughly consider how to evaluate how to give them a certain aspect of care or how to meet needs with them. Just thoroughly understanding their lifestyle makes situations go a long way. I chose this article because when it seems as though a country is progressing, it is vital for one to consider the vulnerable populations, not just citizens that are well off. Strengthening the economy just produces benefits for all, not enhance the wealthy or those who are reaching stability in the economy, but also vulnerable populations and keeping those above those vulnerable populations afloat. It is important to consider vulnerable populations to determine the growth of the economy. We have to recognize how are these individuals going to survive based on the policies that we change or the policies that we attempt to make the economy grow. We have to always take these individuals in consideration to determine growth. How are we going to meet their needs? What specific services can we make better to help with these individuals? How can we promote equality and get these people on their feet? Such as understanding vulnerable populations such as immigrants, just determining how their history of how they had trouble producing and working, and just how they had trouble with certain rights in America. These individuals are known to face health inequalities and disadvantages as well. Public policies should aim to strengthen specific aspects to care for them instead of inhibiting care for them. Historic events, such as in July 4th, 1864, the first congressional attempt to centralize immigration control, which authorized immigrant labor work contracts that enforced them to pay their wages for transportation. This shows that immigrants has always struggled from the beginning of time, and it's very hard for these vulnerable individuals to progress in society when laws and regulations could potentially still be enacted as such. Again, it is important to understand the hardship that these individuals face and reach out to these communities and just make them a part of our society as whole. They work hard as well as citizens that were born in America. It is important to strengthen the lifestyles of these individuals and just bring them up in society, not just focus on the wealthy to determine growth. Social justice overall relates to this article because this article shows that social justice was potentially failed based upon the distribution of wealth and privileges of all. Individuals were not thoroughly enhanced. Rather, they inspected society overall, which produced visualization of whether the economy was growing. They did not consider the individual or vulnerable populations. The public health intervention that was used in this article was policy development and enforcement due to the action of putting new regulations on how government control programs should be strictly controlled in return to get more citizens off of these programs in specific time frames. The disadvantage was that the level of practice was system focused, which excluded the individual aspects such as vulnerable populations. Thank you for listening.